The world of medical disorders is seemingly infinite. Just when you think you've heard it all, along comes something you never thought was possible. Here are 10 rare medical disorders you didn't know about. Stoneman's disease. Stoneman's disease is one of the rarest, most incapacitating genetic conditions. True to its common name, bone tissue begins to grow where muscles, tendons, and other connective tissues should be, effectively turning the victim into a living statue. Around the world, there have only been 800 confirmed cases, and there is no known cure or treatment other than painkillers. And surgery makes the condition even worse. Something as small as an injection can cause bone to begin growing. Tree man syndrome. What appears to be tree bark growing out of someone's skin may actually be epidermodysplasia verruciformis. The disorder known as tree man syndrome is an extremely rare genetic skin disorder associated with a high risk of skin cancer. The tree-like growth is actually a covering of brown, scaly warts and verrucas which grow faster when exposed to sunlight. Progressive lipodystrophy. Known as the reverse Benjamin Button syndrome, lipodystrophy makes sufferers look old beyond their years. In the case of 15-year-old Zara Hartshorn, she was once mistaken for the mother of her older 16-year-old sister. Lipodystrophy gives the illusion of old age through the loss of fat tissue beneath the skin. This causes dents, folds, and wrinkles in the skin. So far, only 200 cases have been reported worldwide, mainly affecting women. There is no cure or treatment for lipodystrophy, besides insulin, facelifts, or collagen injections, which eventually fade. Geographic tongue. Around 2 to 3% of the general population has map-like shapes that form on the tongue. Because parts of the tongue are missing papillae, patches appear that look like smooth islands. The flat pattern on the tongue also changes quickly from day to day, depending on where the papillae have healed. Geographic tongue is a harmless condition with very few to no symptoms, and the cause itself is a mystery. However, there is a possibility of a genetic link, as it tends to run in families. Gastroschisis. Now, instead of missing body parts, how about having most of your insides on the outside? Gastroschisis is a birth defect that prevents normal organ development. In healthy development, the abdomen will close around the organs as the fetus ages. But in the case of gastroschisis, the abdominal wall doesn't do this correctly. Because of this, some of the fetus's organs end up on the outside of the body. In the United States alone, the chance of gastroschisis is 3.73 per 10,000 live births. Xeroderma pigmentosum. This genetic condition is responsible for many terrible vampire jokes, as those affected by Xeroderma pigmentosum have extreme sensitivity to ultraviolet light. After just 5 minutes of exposure to sunlight, those affected will experience extreme sunburns and irritation of the skin. The eyes also become bloodshot, hazy, and irritated from UV exposure. Without the proper protection, nearly half of all children with XP develop some kind of skin cancer before the age of 10. It is estimated that only 1 in 250,000 people have XP. Alopecia areata. This is an autoimmune disease where the immune system mistakenly attacks hair follicles on the head, resulting in patchy hair loss. Alopecia areata, or AA, has 2 other forms. Alopecia totalis is the complete loss of hair on the scalp. Alopecia universalis is the rarest form of AA, which attacks all hair follicles, including head hair, eyebrows, leg hair, lashes, and so on. Strangely, in all 3 forms, hair can regrow randomly and unpredictably. Even though it affects about 2% of the population, there is no cure or treatment, and no symptoms are reported other than itchy, sensitive skin during the early stages. Nail patella syndrome. Does the thought of looking down at your fingers and seeing no nails send shivers up your spine? Those with nail patella syndrome, or NPS, often have no nails, or nails that grow abnormally, split in half, or simply grow away from the nail bed. Another symptom is skeletal abnormalities that limit movement, the most extreme being the deformation or complete absence of the kneecap. Even stranger is the pleasant of iliac horns, small flaring protrusions on the pelvic bone that can sometimes be felt through the skin. At least 1 in every 50,000 people have NPS. Alien hand syndrome. Alien hand syndrome is a rare neurological disorder that causes hand movement without the person being aware of what is happening or having control over the action. The afflicted person may sometimes reach for objects and manipulate them without wanting to do so, even to the point of having to use the controllable hand to restrain the alien hand. Extreme cases have involved involuntarily stuffing food in the mouth and self-inflicted punching or choking. Oftentimes, the individual will be completely unaware of what the alien hand is doing. Alien hand syndrome can occur after a trauma to the brain or as a result of degenerative diseases such as Alzheimer's. Hereditary sensory neuropathy. Those with HSN have a malfunctioning nervous system which causes a total loss of feeling in their body, usually in the legs, feet, arms, and hands. The ability to sense pain and temperature is far more important than you may realize at first. It is not unheard of for those with HSN to break their limbs or bite off a chunk of their tongue without feeling the slightest bit of pain. Not being able to feel pain can be life-threatening in many situations, and because injuries and wounds might be left untreated, ulcers and infections are common. This disease is so rare that its occurrence is simply an estimate, 2 cases per 1 million people. If you enjoyed this video, be sure to subscribe to our channel for more Top Truths content. In the meantime, feel free to take a look at our other videos here.